I am Dr. Rajat, Academic Director of DBMCI, and today I am sitting with Dr. Shushma. Dr. Shushma is a radiology resident at RML Institute. She was our student from Bangalore and she has scored 76 rank. I think that congratulation period is over.
Yes.
So I have called Dr. Sushma for a specific reason. The exam is very close, and exactly 1 year back, the Sushma was also having the same issue. I'm getting a lot of messages from the students about the pre-exam anxiety and the exam phobia. That there are a lot of students, they are not able to study at this point of time. They are not able to read. There are a lot of students, we are talking about revision, but they were not able to finish the course at this point of time. So I'll give you my view on this, that what should be done, and I will take the view of Dr. Sushma here. It's a non-scripted interview. I haven't even told Sushma what are the question that I'm going to ask her, because I want her genuine answers,
Yes, sir.
as a student who is appearing for the NEET 2020, and she has scored a result. So I just wanted her genuine total opinion, that what she had done at that point of time. So it's a non-scripted interview, and as I always take non-scripted interview, and I will recommend this to all of you from an institute platform, that once you gonna become a topper, please make sure to guide your juniors properly. Please make sure, do not give fake interviews anywhere. Do not give fake interviews anywhere. Try to tell, even if somebody is calling you, try to tell, the first thing that you should tell is what course have you joined, what is the honest course that you have joined, because these interviews matter a lot to the people who are preparing. I have never taken any fake interview in my life, and I will never do that, and I will suggest it to everybody, that please do not use this as a matter of, you will gain enough publicity if you have scored a rank. So try to give credit to the person who has put lot of efforts to you, who have worked hard for you. So, and rather than just for some publicity or for some other reasons, do not give fake interviews. Okay, so coming on to the pre-exam anxiety, or the exam phobia. So rather than I speak on this on the basis of my experience, I'll do that at the end first. But let us see, Sushma, when you finished your course, like your exam was again in the January,
Was in
and
January.
we finished the Bangalore course in the September, and
September.
same almost
Yes,
10
yes, sir.
September. So were you able to finish everything at that time?
Actually, our course started on March 31st,
Yeah,
sir.
so almost that
So,
is the same. Yeah.
so every time we had gaps between two subjects, I used to come finish the subject which was done. But every time we had a longer gap, and I used to finish this subject and also take
The
on the
previous
previous
one.
read
Yeah.
subjects because I would have
That's
obviously
an ideal
forgotten it.
way, but let us say that, okay, so go ahead.
So by the time at least the last subject would have done, I would have at least finished the previous subject at least once.
Okay.
Because if today was the last class, except for this subject, the other subjects at least I would have done once because of the gaps I have in between. But uske baad till we had I think October 7th was our CBT. So for that I had to be prepared because that was I was like 2 months away from NEET, and that was the exam which the all India students who are actually preparing like I was were actually giving it. So I wanted to do well in that because that my all hopes, my
Yeah.
encouragement, my everything would lie on that exam.
Hmm.
So I made sure I had maybe 3 weeks, 2 weeks for CBT. So the uh, subjects I was actually good at, I try to read them once before I go there because I actually wanted to do well in CBT exams. Because if I score well, then I would have my confidence would be boosted,
Yeah.
and I will have like, oh my God, Sushma, you did well here 2 months before the exam. In 2 months, you can do even more better. I didn't want CBT to go badly, and all my confidence would go away, sir. So if their CBT is done, sir.
Yeah, so this time we did it
Acha.
1 month, 1 week ahead.
Oh,
Like, in fact, the Bangalore people, they are writing it on second.
oh,
But
okay.
because there were like number of students who are writing the computer test for DBMCI this time,
Hmm.
they are huge. So it was practically not possible for us to manage everybody
Oh,
in one day. So
Acha.
we are doing 2-3 sessions
Okay,
this
sir.
time. So the Delhi people have done it yesterday.
Hmm.
There are a lot of students who are doing it today, and the Bangalore will be doing it on 2nd.
You have anyway test 2 also, no, sir? And there are other things
Yeah,
in
yeah.
grand tests and
So
all
now,
that.
see the problem that that you are facing, students are facing is. So let me tell you. See, you have seen. So she has given the exam with lot of sincerity. So all those students who are watching this, I will suggest to all of you that please write the exam in a way as you're writing your final exam. As you heard from her, that she wanted to do well in the exam because she know that if she hasn't performed great, she has some time to improve on that. It's a mirror that you're looking at the mirror. So when people talk about exam phobia, I say exam phobia is pretty obvious. It is gonna happen, but it happens to only those people who have not attempted the exam. Okay, so imagine during your internship or your first year anatomy when you have kept the scalpel in your hand for the first time and somebody told you, okay, put a nick onto the patient's body. Imagine the phobia that you had at that point of time. Think of the second scalpel that you put, think of the third scalpel that you put, think of the fourth scalpel. As the time passed, it became much
Easy.
easier
Yes, sir.
for you to do that. Imagine when you took the first sample of the patient. Whenever you took the first sample of the patient, it was you were shivering that how can I put a needle into the patient. You were shivering, and every time you're putting it like that. The second time your hands were more stable.
Yes.
The third time it was much easier, and after another time you can close your eyes and you can put it. So that is the whole idea. Whenever you are doing the thing for the first time, you will have phobia, and that is why we suggest you to write the exam, because if you will not write the exam, that phobia will be there in the final exam in the NEET. I want you should write these many exams so that once you are going for your NEET, it is like you are writing a Bhatia grand test, you are writing a Bhatia CLT, a Bhatia CBT, whatever. So that's the whole idea, that you have to be prepared. One second thing that you have to prepare, why this phobia is increasing day by day. Now there is something called as FOMO, fear of missing out. See, no matter what you read, there are always information that you are not aware. So I am talking to rank 76 over here, and tell me, during your preparation, during your revision time, have you come across the questions that you cannot answer,
Oh,
or you haven't
yes.
come
Too
across a
many.
question?
Too many, sir.
What was your reaction to those questions?
There will be few questions that will not know, sir, but then it's okay. You're not supposed to let yourself down. If you don't know like 2 of the questions out of the 10 questions, that's not a big deal. Even
Yeah,
if you don't know 4, it's fine. But if you know the 6 and you can answer them correctly, that brings you way ahead of
that's
the
that's the
other.
that's the whole point. Now just think about that. Even if you'll ask me, there are chances that you ask me a radiology question and I say I don't know the answer. It's a medical field, it's a changing science. People are selling fear and we are buying fear. Okay, they have made their online papers so difficult that you cannot select the answer from those, and that is why that phobia is increasing in your mind day and day. Now let me tell you that the paper that you get in the NEET is not very difficult paper. It is not very difficult paper. It is a pretty simple things that you have read in your classes. All that matters is, are you able to recall those things in the classes, in your exam. So what I suggest to everybody is, whenever you are attempting the paper and you mark the wrong answer, now please ask yourself, have you read this topic? If you have read this topic and your answer is wrong, that is not acceptable. That's all. That is the only thing that I suggest to everybody, that if you have read something and you are doing that wrong, what is the point of reading more? There is no limit to more. Try to identify that. Day you are able to do the things that you have read, only then try to move forward. There will be people who's gonna come to you, there will be your batchmates, there will be your seniors, there will be your juniors who do not have any business. They have only one thing, they want to put you down. They want to put you down. They're gonna put you 4 questions from somewhere which will never be asked in the exam, and they say, oh, give me the answer, and you don't know the answers, and you are depressed. You're like, oh my god, what should I do? See, every person is unique. Do not bother about them. Bother about your own preparation. Bother about the things that you have covered, and then try to take care of that. Now let's talk about this pre-exam anxiety. Sushma, you had the pre-exam
Of course,
anxiety
sir. Too much.
during your preparation.
Yes,
So how
yes,
did
I
you
did.
handle that?
Sir, once in the first time you get that anxiety is actually really bad to let it go. I actually used to watch Friends, because that used to be my stress buster. But I also made sure ki I don't actually indulge into that free thing so that I lose all my time. It's just that if you're actually focused, sir, when you know what you have to do, when you have that goal, a little bit of free time, it's okay, you can use it. I used to talk to my parents, let out all my like, I can't do this, mama, I didn't answer this, I didn't answer that. I used to just let it all out, tell all my parents, and then there's like, it's okay beta, kuch nahi hoga, you'll do it. It's just those words that they say it, they have their hopes on us. It made me feel like, okay, they are supporting me so much, I have to do well. So when talking to your parents actually helps, they give you that boost, that
Yeah.
morale. It makes me feel like, okay, I have to do something for them. And just when I speak to my parents, I used to feel, okay, that's fine, I have to read for them, and go back to reading. The first time when that fear comes that I'll not be able to do well, that is actually a very difficult
Yeah.
thing to handle. But the next time you get it, you can easily face it.
Yeah. Yeah, so she has raised a very, very valid point, and this is what I will say to everybody, that see, this pre exam anxiety is gonna be there in everybody's mind. Try to find out the people to whom you can trust. That might be your parents, that might be your girlfriend, boyfriend, that might be your best friend, that might be me. Okay, so try to identify that person. If you do not have any person, I am available for all of you. That is what I can say. Okay, but try to identify the person to whom you can trust upon. Okay, put your frustration into that. Okay, because ultimately you have to let it go, because the if it will is gonna build it up on you, then it will create a problem. Now for her stress busters were the TV show or parents. She was close to the parent, but not everybody is so close to the parent. That's okay. That is absolutely fine. To whom, with whom you can open up, wherever you think you can let down on your anxiety, because at the end of the day, all that matters is your hard work. If your hard work is getting compromised at any point of time, it is gonna eat up your rank. That is as simple as that. Okay, so at no matter, your hard work should be compromised because of whatever reason. When stress comes, you have a stress buster. Please try to put it on that. Maximum that will happen is your rank will be compromised. Okay, that is one thing, which is a very, very, very big deal. But at the end of the day, you should not feel like you have not put up enough efforts. If you have put up enough efforts and your rank is compromised, I am telling you, 99% of the time you say, okay, that is my 100%, at least I have given my 100%. So try to give your 100%. There will be time that will come that you are not able to sleep. I'm getting a lot of messages that I am not able to sleep, as a result of which my next day is wasted. I can tell you that I got rank 1. Even then, I used to have these kind of problems. Not always, sometime. Even before my all India exam, I was pretty restless. I was very, very restless before all India exam. It did not happen in any other exam, but I don't know why it happened that in my all India exam I was restless, and I'm committing it on a live platform that I had to take Zolpidem to sleep
Right,
before
me too,
my
sir.
all India exam. So it happens with everybody. It did not happen in any other exam, but it happened with me in all India. It did not happen in my state PG at that point of time, but it happened with me in all India. Okay, so that's a part of your journey. That's a part of your life. Okay, that is okay. Just release it. Just take it out. Okay, it will happen. It happened with me. It happened with her. It will happen with you also. But you have to take it out. As I told you, try to find out the person who is a very, very big support at this point of time. If you cannot trust on anybody, trust us, because we are there for all of you. Okay, so try to talk to me. Try to talk to the people to whom you can trust at this point of time, and just take it out. Do not go into this fear of missing out. Rather, try to learn to the things that you are already aware of. Okay, if you have some sleep, please have a decent sleep. I will not say that do not have a sleep. Please have a decent sleep. uh, at least 5 to 6 hours is the requirement. That the minimum requirement that a body needs at this point of time. That will be very, very useful for you. Coming on to the last point about the exam phobia and the attempt of the grand test, please try to do them. Those who are still left with the CLT, please make sure that you are writing the paper. Write the paper by going to the exam center. By going to the exam center, appearing it on a computer at your home will not give you the same simulating atmosphere, and that exam phobia will continue. Okay, now that's a commonly what we say, डर के आगे जीत है. So that is the same thing, that the moment you are able to overcome that phobia, there is a victory lying ahead of you. So try to get to that particular victory, and I am very sure that you will be able to do that. So I have got questions, and now we'll start taking question. I was confident till yesterday, but after the grand test, I am so much worried and depressed. So many questions that I could not answer. So that is gonna happen with every exam. That is gonna happen with every exam. But now what you have to do is you have to analyze that why you were not able to answer so many questions. Why you were not able to see. Do not get depressed on this. It's a mirror that you are looking at. Just imagine you wouldn't have appeared for this grand test. So that would have been your worry at the final NEET exam. Okay, so just try to see why you could not answer so many questions. Are you actually thinking it's so many, or there are only 10 questions? Because there will be 40 to 50 questions that you will not be able to answer in the exam. Do not worry about them. Okay, just try to see how many questions are there that you have actually read during your preparation and still you cannot answer. Is it because you are not able to recall them, or you have not read them? Okay, so try to divide them. I will divide them into three categories. First, I have read the topic and still I can't answer. I have not read the topic. Okay, so this is the two broad division. I have not read the topic, I have read the topic and still I can't answer. If I read the topic and still I cannot answer, again there are two aspects of that. One is I have forgotten the topic, or second, I have not read the question properly. So there are three basic things that are happening if your answer is wrong. You do not know the topic, you have read the question incorrectly, or you have forgotten the topic. Three problems have three different solutions. If you have not read the topic, the solution is you have to read more. If you have missed the information in the question, you have to practice more. And if you are forgetting the information, you have to revise more. So you have to see where is your problem and you have to take care of that. Sushma, what about your issue with these three things?
No,
What do
sir,
you say?
it's right. Yes. If you don't know the topic, at least for now, it's fine because it's not your fault. You haven't read it, you couldn't answer it. That's normal.
Exactly.
But if you've read it and you still couldn't answer it, that is a little bit of a problem. But now you still have 2 more months to know which are the parts which are actually you keep forgetting. I used to always, when my notes are, I used to make doggy ears where in those pages where I couldn't just remember anything, like half lives.
Yeah,
I can't remember
that
them.
that
I
that will
needed
happen. Yeah,
a revision just before I go, like 2 days before I have my exam. I have to look at it once so that I remember it, because it's not possible that you read it now and you answer it 1 week later.
that is true.
That
Yeah,
is why I used to make little years wherever I had, like, I need to read this before the exam. You can write it down if you want in a separate piece of paper, but I used to find that they'll again take much of my time, so I used to just make um, fold the pages
yeah.
wherever I have to read
I
it.
mean, identify your forgettables and
uh,
revise them again and
yes.
again. Okay, that is the only thing. So, Anakulam, do not get depressed on this particular part. Rather, it's a very good thing that you have done. Okay,
At
please
least
try
he
to.
knows where
Yeah,
is
now
going
you know
wrong.
what is going on. Now you know, you have a mirror in front of you. You know that your confidence was there. What was the confidence? Now let us see the result. There are chances that you are thinking your paper is wrong, but it's not actually. Okay, there are chances you don't know the score yet. So let us see the score. Let us see the rank, and then we're gonna take a call accordingly. Okay, then identify these three things. Do not know the topic, not read the question carefully, or forgotten the topic, and then we're gonna take a call, and then we'll decide that what has to be done in that particular case. Okay, any more questions that you want to put up? Please put up questions. Either me or Dr. Sushma is gonna answer that. If you have more questions, so do not worry about all this, friends. Pre-exam anxiety is a pretty common thing that is going to happen. It is a part of a human nature. I have given you the examples. She is sitting in front of you, she has told us. I have told you that my example. So this is going to happen. Do not come into the trap of missing out information. Trust onto the things that you have read. They are sufficient to get a rank that you are looking for. Set up your goal. Try to identify that where do you want to reach. Try to push yourself to the best of your efforts. Okay. So I read the topic but can't reach up to the answer because question asked in a different perspective. Yeah, so that is what is happening, that when you have read the topic pretty superficially, and that is happening, and that is one of a common reason that you need to be aware of in the exam, because at the end of the day what happens in an exam is that you are stuck with two choices, and we have spoken about that in our special session in the vibe also. So what I'll suggest you to that you have to do is try to, in your revision time, try to make differentiating tables. Now, in differentiating tables, something like that, try to identify that uh, what are the differences between these two diseases where you are getting confused. Like in a radiology, we said CMV and toxo, both are congenital infection, both causes calcification, both are torch group infection, but I know one causes periventricular, one causes diffuse nodular. Similarly, you need to know what is the differentiating feature between Lambert-Eaton myasthenia gravis, which improves with exercise, which worsens with exercise. Similarly, you need to know what is the differentiation between cryptococcal meningitis, tubercular meningitis. Okay, so try, you need to know what is the difference between anorexia nervosa, bulimia nervosa. What is that differentiating feature that is taking you forward? In whichever question you did it wrong, try to put it that, try to make those tables and then move forward. Now this is a time, those who are aiming for the great rank, rather than revising the subject, try to revise the diseases, try to revise the topics, but that is only if you are already at a great level, if you are already at a level when you are little bit confident about all your 19 subjects. Second point is, if you think that you have not covered the entire syllabus at this point of time, that is okay, that is absolutely okay. Every student has a different speed, every student has a different speed. Some are very fast reader, some are slow reader, but those who are slow reader doesn't mean that they are weak. Those who are slow reader, sometime they are like a bamboo, that the post that I shared onto the premier group, that they are growing their roots inside, and then they will take less time to revise. Okay, so do not worry too much about that, but then try to finish it early so that we can move on to the revision where we can identify what are our forgettables. Agra, is this some question pattern changes in this coming NEET also? It is very, very unlikely that they will change the NEET pattern. Government has already done so many experiments, and they have already done a major experiment. So they will not take any panga at this point of time. So they will not change the pattern. How to accelerate my preparation along with hectic internship? My preparation is going mark till now. You also went okay, yeah. So the internship is always a challenge. In MAMC also we used to have very very heavy internship. Uh, so that is you have to spare out time. What we used to do, we used to have a lot of pocket books in our aprons, and whenever during the internship you get time, you try to revise your forgettable, and the moment you come out of your internship, even if you're coming at 4 o'clock, you know that from 4 to 12 you have that much time to read. See, once your goal is clear in front of you, you will find a path to achieve onto that particular case. Try to request your PGs, try to make good relations with your PG, so they will sometime give you break, and then you will be able to do that. But yes, the clerical work of the internship uh, poses a very very big challenge for some of the medical colleges. I do agree, then that's a big problem, but you have to tackle it intelligently. If you're determined, Jhansi Center, then definitely you can do that. We all have done that. In fact, for me, my September October posting was a surgery posting, which is a very hectic posting. But as I told you, that because I was determined, in the post duty, I used to read a lot. I have deliberately put up the things that I was pretty good at during those time, and I was able to achieve onto that particular part. There was one common message that I was getting from a lot of students is, that with this internship you cannot crack it. I can tell you that internship is the best time to crack it, provided you are determined that you want to crack it. As you have said, if you are determined to crack it, I am very sure that you will be able to do that. In the yesterday's exam, after first few question, mind went blank and couldn't read the rest of the question properly. Anakulam, you are giving me deja vu. You are totally giving me deja vu. The same thing happened with me in the Ames exam. My first exam, the PG entrance, the final exam was the Ames exam, and I was very well prepared with the Ames exam. The moment I opened up the paper, I went black, and I was able to gain my senses properly after 45 minutes. The net result was I spoiled my exam. So that is a big problem that happens. But then later on I realized that if you don't know 4 questions, this will not do anything, because there are more 196 questions more that are there in the paper, and sometime the initial paper might be tough. So do not worry about that. Just think a paper as a whole. Second, do not try to compare one question with the other. Try to answer each and every question separately as it's one question, and then you're gonna do that. I will take your opinion on this. What is your suggestion
Yes, sir.
to this doubt?
Actually, in some exams, actually, all the difficult questions would have come first.
Yeah,
And that doesn't mean you don't know the first 10 questions, so you'll not know the rest 190. It's not like that. The things you don't know might have come in the first 10.
yeah,
In the next 190, you would know 180 of the questions, and
yeah,
that is, you will get rank 1 with this.
exactly. Yeah,
So that's not a problem. You just have to, if you don't know the question, just go to the next one
yeah,
till you get that part of the paper where you know all the questions.
yeah.
Then that'll give you again
Yeah.
confidence. You can come back to the first one.
Exactly, and that is why I suggest that we discuss in the NEET special session also, that though different people have got different way to attempt the paper. The way I attempt the paper is, first I try to the questions which I am 100% sure, because that gives me more confidence that yes, I know the paper. Okay, I was taking a quiz in Bhopal yesterday, in the Ames Bhopal, and what happened was there was a rapid fire round, and there were 15 questions. Um, so the student have to answer them in 1 minute. So there are a lot of students who answered very correctly, but because they were taking a lot of time, what happened is they were able to answer only 5 questions or 6 questions or 7 questions, whereas the rest of the question, the lower questions were pretty easy. Now there was a smart team. What they did is that the moment they were not aware of the answer, they move next, because what they wanted to see all the questions, and they were the one who are the winner in that particular quiz. Okay, so that's the whole idea. It is about being more smart into that. Okay, so if you cannot answer 1 or 2 questions and you are spending more time on that, it will eat up your time, and you will get more depressed because your time is also running out. You are not able to answer them. So rather quickly go through the paper, and I can assure you that you will be much more relaxed in this case. Okay, all right. So if you have more questions, just let us know. Otherwise, that is all from our side, and I'll once again say that do not worry about the exam. Trust on you, trust on us. We have taught you enough. That is more than sufficient to get a rank that you're looking for. But do not come into the trap. Try to read the things that you've already covered. Please make sure after reading the notes you are able to do last 2 year NEET paper and the last 4 to 5 year Ames paper. If you have done it from a source, that is very good. If you have not yet done it, get the to the point book. That will be very useful for you in your preparation, because it is, as the name says, to the point, as per the NEET pattern, all the information that is required in that. Then if you are able to do this, you are already scoring a pretty decent rank. But please make sure that whatever is written in these 2 places, you know it in and out. Do not worry about the exam. Practice. If you are not able to do well in the exam, do not worry. It's a mirror. You have to improve on that mirror. Imagine now that you are doing a makeup, you're doing a makeup, and you are not able to do it very good in one go. You can't say no. That's okay. You can modify it. So that is the same thing that you have to do. Okay, all right. So if there are no more questions, we will stop, and we will start with your session, the regular session. Okay, after 2 weeks I'm gonna come with one more session with all of you, and keep bombarding the WhatsApp, keep bombarding the messages to me. If you have any doubt, do not hesitate. I am available for all of you. I wish you all the best for
All
your
the
exam.
best.
All the best.